Oh, Lindsay, thanks for arranging this. I know we went back and forth quite a bit. So I think we up front don't have any questions. We're just eager to see. So there's two. So Lindsay, why don't you say your title?
I'm Executive Director at the Consortium for Older Adult Wellness.
Yes, thank you. And then Joni is her title?
Joni is our program coordinator, and she runs our National Diabetes Prevention Program work and also runs Workshop Wizard and also is a part of the team that is doing on-site training yeah, so this is true. You can do webinars from anywhere.
Is it Joni? Is it Saunders? Is that right, or what's your last name?
Yeah, you.
Okay, S-A-U-N.
And it's Joni with an I.
With an I. Okay.
And you can feel free to email us, question us, send us anything. I know Joni and I always talk afterwards, so if there's any questions that we didn't get handled, we'll make sure we get you information. And I know Joni's just going to walk through everything with you, but she'll have lots of time for questions. So you are in great hands.
Excellent. Thanks, Lindsay. We'll be in touch.
Okay, it's a deal. Have fun, Joni.
Thanks. Bye, Lindsay.
Bye.
Walk you through Workshop Wizard today. One thing to definitely note as we are beginning to walk through this is it's a very robust system. And since we're doing a demo and just trying to give and share information here in the entire system. Hello.
Oh, yep, we're here. Are you there?
Okay, good. Yes, definitely. You're going to be seeing quite a bit of functionality. Now, depending on a person's role and access with Workshop Wizard, that functionality would be limited. So it's going to be a bit like drinking from a fire hose today, seeing all the different things that we can do. At the end, and if we want to continue to move on, we can set up a demo site for you all. Workshop Wizard for you, where that, of course, would be, private information. So everything you'll see here today is made-up information, and just for the demo. I'll be adding information. You'll see some information I've added from other agencies in here. Again, none of it is real information. And so you should be seeing currently, right now, a basically blue and white screen that says Workshop Wizard and has a user ID and password. Now, your organization will... Oh, go ahead.
Hey, Joni, I was just going to tell you who was in the room because we haven't done that yet. But we do have, we have three. Myself, I'm the project manager for the Independence Through Healthy Aging grant, and Kate Houston, who is program
development director.
Program development director, and David Fink, who's
program developer for evidence-based health programs,
and Lisa Graham, who is our health
partnerships developer. Yep.
Okay, so we have the key people that would be using the system. Our director should be hopefully here shortly, and that's Don Simonson. So let's up front, how much time have you scheduled, and then should we hold our questions, ask questions as we go along? What's your feel on this?
I would like for you, let me check on Mountain schedule here. It looks like we are scheduled till 10:30, which is 11:30 your time. And I will stop after each of the sections and see if there's any questions at that point. But yeah, feel free to stop me as we're going. Sometimes that's a little bit easier when we're looking at software here, so that I can address right then. And there might be a question where I'm like, okay, we'll get to that in 1 second. I'll come back to it. But yeah, feel free to stop me as we're going.
How many sections are there?
Do we have a sense? There are 5.
5 sections, okay. Okay, good. Thank you.
You'll see those sections really quick here once I get logged in. Could be 6. Trying to think of, I go through them by access here and limit the kind of access that they have to Workshop Wizard. So, of course, I'm going to just use my information to log in. Say have an administrator that limits the access of what they see.
Yes.
As you can see, there's a lot of functionality over here in the green area. However, you might have someone that just is responsible for enrolling people into classes, and they would only see this section where it says referring entities, referrals, referring individuals. So not everybody will see all this functionality, but again, I wanted to be back closer to the end on this. This is actually going to be where, if you're doing the National Diabetes Prevention Program, this is going to be where you're tracking weight and activity information. Find, this really is going to be an overall chart showing you the linkages of the functionalities that are over here in the left. This can work as a quick find system, search system, or just a quick edit system. Everything here that is in this find area is going to be listed over here in our green functionality. This is just kind of a visual representation of how things link together. So where I'm going to start getting into the meat, I'm going to start with people. And people is going to be our area where we're adding anybody who is a contact, someone who has been trained under our license. It could be an organizational contact, someone that is a leader for our organization. This is not where we enroll people into our community classes. That's going to be under the referring area. So people is everybody from, we have a master trainer in the CDS&P program to Bob needs a Christmas card. And so we come back to the search function here in just a bit, but I'm going to start under general. And there's two things to always remember, or maybe actually three. One, the system's only going to be as robust and as useful as the information you put into it. Two, you always have to tell the system what you want it to do. And then three, make sure you save your changes. So I'm going to go in here. And as you can see, I have several functionalities across the top here. And what I'm going to do is, in general, I'm just going to add a person. Now, I know I'm ready to add a person in the system because I have this gray new add person, and I might have these two tabs actually become populated. I'm just going to go ahead and add Nora. And
You need the spelling? Are you still there?
No, I'm here. Can you see? Can you see what I have on the screen?
So there we go. Okay. Yep.
There was just a lag.
Yep. That's it.
Of course, everything in here you would want to add as much information for time's sake. I would, you would add, of course, work and address, all that kind of information in here. But I'm going to actually go through and I'm going to now give Nora people types. And so these are the different types that are over here, and this is going to be ways that I'm able to search and also add connectivity to the other areas, other functions. Referral handler, a site contact, and let's make you a workshop contact. And then I'm going to save that information. All right. So if I went back to search here and I just searched all the people we have in our system, this is how many people we've populated. Some of these are made up out of Joni's mind. Some of them are real people. None of their information is real, but just to get an idea of that, we do have quite a few people already listed in here. One thing I do, again, want to show is over here in this people type, you are able to add as many people types as you would like to under the people tab. So if I wanted to add a type, and I saved it, so I'm saying that I have a triple little bit slow today. I'm on I'm in a hotel room. So sorry if my internet is getting a little bit slower than usual. All right. So, as you remember, just a second ago, I added the AAA contact, and now you see that that shows up as an option for my people type. So I'm going to go ahead and just say that she's also AAA contact. So if I'm also looking up here and I'm adding someone to the system, and I want to go into classes, and I want to find out all the roles that Nora has played in different classes. So I might be able to find her as times that she has been a teacher / facilitator / leader, times that maybe she's been a student, so that she's been trained as a trainer, or that she's done fidelity. So she's gone to a specific curriculum to make sure that they are presenting the curriculum to the standards of that curriculum, and I can show that person as a fidelity person. So if I add under here, I'm going to say let's add her as a student. Here we go. So if we did a leader training, and Nora was part of those leader training for a chronic disease class, basically we would just select that and say add a student. And now that will show up in all of her class information. And that's just a way to keep track of when people have taught, when people have been trained, or when people have done a fidelity as a fidelity coach. Under certificates, this is where I'm able to keep track of the certificates that Nora has. And so if I would like, if Nora has just done training in matter of balance, I'm going to say let's add a certificate. So we're going to make that certificate active. We're going to say that it was leader training in matter of balance. It was issued today, so it's going to expire 1 year from today. And then I would save my changes. And as you can see, it populated now that Nora is a leader in matter of balance. Here, under access, this is where I would give the different roles, the different people who would be using Workshop Wizard, their access to Workshop Wizard. So this is where I would give her her username and password. This is where I would give her the different level of functionality. So she maybe only needs to see these first 2 sections. The rest of these sections wouldn't show. And so I can show that to you later, a little bit later. This would also be where we can limit the reports that Nora can run based on the organization that she is working with or the department that she's working with. I'm going to go back to search here. And I'm going to go ahead and just search anyone who has taught CDS&P. And I wanted to get a list then of the people who have taught CDS&P, and I would like to be able to look and share that list with somebody. All I have to do is go to print, and everyone in that left-hand area, their contact information will show up now in a format, so in a report in real time. I can also export this information. So that if I needed to do a mail merge, share the information, take out someone's information, this allows me to be able to do that with a CSV file. So basically, okay, is everybody hearing me okay?
Yes.
Yep, gotcha.
Okay, wonderful. I just got a little message from GoToMeeting that said it was hard to hear me. So anybody that gets pulled up into this left-hand column, you are able to print or export information about them. So again, let's go to search. And maybe we just want to pull up all of our active leaders. I search. Now I'm able to get a list of all of our active leaders that are current. Here we are. All right. So again, with the search function, we can search people by their names, first name, last name. We can search them by their organization. So once an organization has been entered in, and I'm going to enter in the organization here in just a bit, and then I'll go back to Nora and put that as her organization. We can search by state, which curriculums people have taught, the curriculums people are certified in, down to the when their certifications are going to expire. So let's see who all certifications are going to expire in the next 18 months. So lots of people are going to expire in the next 18 months. Let's do about 12. So we're able to actually go in, and then, like I said, we can search just our people who are going to be our site staff. So if we just want to get down to who we should call post the class, we're going to search doing that. So we went to people types already. Again, you have unlimited access to the amount of different people types that you would like to have as searchable. We also have met through. And this can be anyone from I met someone through Lindsay to I met someone at the 2016 ASA conference. So if we were going to want to do something like that, now I have the ability to say that I've met through the AIA conference for 2016. If I went back to people and look at Nora again, and I wanted to be able to make sure that I have that information in here, I just go back basically in so that I can record that, and now I know that I have met this person through that conference. Again, that can be anybody, any person, any conference. It could be we met them through a newspaper.
Okay.
Okay. So I'm going to go ahead here to see, do we have any questions so far on the people area? The people.
Oh, I think we're good. We
a broader, big picture of kind of what the system will do at a pretty high level, maybe a little bit less on the exact functionality of the individual pieces.
Absolutely, and so I'll do a higher level here, and then basically, if you want me to dig deeper into an area, just let me know, and we can go deeper.
Great,
okay.
Great,
sounds
wonderful.
good.
Wonderful. So I'm going to move into this new tab here. This is going to be where we keep track of all of our different license holders. Information about license holders and just this can be for NDPP that there's not necessarily a license holder. However, this could be the organization overseeing recognition. This could be who holds the license for your CDSP classes. But would be our overall our email systems that we're working. Underneath Kaiser, we have organizations we're working with. So folder, we can link it to a contact that we put into the people system, and we can also link it to a health system. So again, we want, if we were working through Kaiser, we would want to say Kaiser East is hosting classes at multiple sites. And so our site information comes in here where we add a site and then we link that site basically to the organization that we are working with. So again, we would just go in, say we'd like to add a site, and then depending on the organization that we're working with, we would just identify that organization, and then that site would then show up in that organization's site list.
Joni?
Can we come in? Yes.
So in that group there, so we have a hierarchy here where we've got a statewide presence. Below that are the area agencies on aging, and below those are implementing organizations. And then you've got your sites where you actually, so is there any flexibility in renaming
the ability to make changes. We would just have to find out exactly what those changes are so that we are able to share any type of programming costs with you prior to doing the programming.
Okay.
But
They offer sort of changes in programming as part of their package.
Right. Okay. Okay, thank you.
If once we know what those are, we're happy to send you basically a bid and go over what that information would be and see if that, is something we would like to move forward on.
Okay.
But yet, the overall answer is yes, we can make changes.
Okay, Joni, just to let you know, our director's here now.
Hi, good morning. Sorry to pop in late here.
Good morning. I'm glad you're able to make it. And please feel free to stop me or slow me down as we're going if you have any questions. But again, yes, that hierarchy definitely will work. And we would be able to kind of map that out, what you would want specifically. Of course, everything that you see on here is going to look like your agency. Rather than just saying Workshop Wizard, it will be like your logos, your information, that kind of thing. So kind of
So totally branded. Totally branded with our whatever, however we want to brand it.
That's correct. That's correct. Okay. So, and again, I don't want to move too fast. I'm definitely get into details with some of these. So, if you have any questions, kind of to see how the functionality connects here. Again, I'm not sure if you remember when we put Norm a people type, then it is going to populate into the different areas to select them under. So if my slow internet will pick up, there we go. So I'd identified her as a site contact here. So whenever, if I go into the sites or organizations, then I have the ability to say that that's my contact person here. So any questions on this? And that is too high level?
Oh, that's just the right level. Excellent.
Yeah, that's good.
Okay. All right. So these next three sections for me as program coordinator, this is where it really, the functionality really begins to help for me. I apologize for my slow internet.
She's in Alamosa, New Mexico, in a hotel room. Done.
Well, thank you.
Okay. So curriculums, again, these are our overall curriculums. So anytime we're adding a new curriculum, so if maybe we are wanting to put in, CDS&P for crime disease self-management, or if we're wanting to put in two systems, or if we're wanting to put Cooking with Joni on Saturday. These are going to be any of our overarching curriculums, the general curriculum. We would put all of that information in here just by saying we would like to add a curriculum.
And Joni, you can because as you know, some of the different Stanford programs and other programs have different names that they use locally. We can use those names as opposed to the standard name.
Yes, that's totally okay. Because you have the ability to put in whatever name you would like.
Okay.
And this is also where you would put in any type of leader training. So if you were hosting a leader training in Matter of Balance, but you called it leader training for balance, matter of fact, then you can put that in there however you would like to. And so it's just a matter of once you go into your workshops and trainings, making sure that you're keeping the workshops under the correct curriculum. So again, our curriculums, those overarching curriculums, but again, we're going to host workshops and trainings, and this is going to be where we are actually able to go in and set up our different workshops, trainings, and locations. So I'm going to come back to my my search in 1 second, but I'm going to go to general. And if I wanted to add a new workshop, of course, I tell the system I'd like to add a workshop. I pick whoever the license holder might be, the curriculum that we would like to to be doing. Again, this can be, the curriculum can be anything that you're hosting. And of course, then we put in all of our information about the new class.
Too much. Yeah, I think you know, we get the idea there.
Okay, wonderful. So once you've gone through and you've saved this information, this is all going to populate into the referring entities. One thing, the reason why I was going through and putting it in, which I can go ahead and move into search, is that it won't let you save a workshop unless you have all pertinent information in there. So you can't go in and basically say we have a workshop, but we don't know any dates or time. So it's going to have something populated in areas to let you search by our site. That would pull up a ton of all of our different information for each of the sites that we have a workshop. We can search by curriculum, for dates, and of course by organization. One thing I like to show is that we can search by our canceled classes. Sometimes this is very helpful to see which organizations have canceled or are canceling on a regular basis, or to just see patterns. To maybe there's a site or an organization that we're having transportation issues, or the target market is the right market. So these are going to allow us all different ways of actually searching for the different workshops that we have in our system.
And Joni?
Okay. Yes.
So we're talking about you're running the system and you're doing a search, and I'm assuming kind of after you've gone through this, participants or people in the public can go in and find a class and register.
Self-refer, receive a fax, get a secure email, and then that information they're put into a class under these referring tabs, under the referral tab. So
people can't register themselves. You have to contact somebody who then enters you into the system.
That's correct, unless you have unless we have a connection between that pushes all this information to your public website, which that is definitely something we can talk about. So for example, pull this up here real quick. This is our site. So basically, yes and yes and no. So we can register people via a secure registration that they are able to do that for themselves, but that would require just a different level of programming as far as connecting the Workshop Wizard system to your public website. Once that happens, all your classes, once you've added them into Workshop Wizard, will push directly through your website, and so you won't have to populate in two places. That once the class is entered, it'll go directly to your website and show up there also.
So then you have a fairly, as I recall from your website, you have a fairly user-friendly way to sign up for classes, which basically what it does, you go to your website and it links into this database, and you can sign up for a class. Can you do zip code searches, give me matter balance class within 15 miles of where I live or something, that kind of thing?
Yes, we can. Yes, we can now. Well, just done with Maryland and New Mexico is we've set it up where we even, not only can you go in and search a word search, but you can search using a map system. So you can click the area where you want to have a class.
So, Joni, I have a question about, we're the centralized data manager, so we would see everything, but then our partner 5 AAAs, people would go in to register through their AAA sites?
Mm-hmm.
Okay, so that might be interesting. So it would have more of a local feel to it, but yet we're able to track everything, and that those AAAs would have permissions to get in to see the aggregated data.
Well, you could build that, but you'd have to build a separate interface in that area. So I'm
different ways
assuming
to
that's
look
what
at
you're
it.
saying. To have that self-registration, John Q. Public thing, you've got to build an interface into our website or some website somewhere so that you can actually do that registration. And if you had multiple websites throughout the state that we wanted to have them come in through their AAAs, you'd have to build a different interface for each of those, is what you're saying. Is that right, Joni?
That's correct, or to have a centralized one like you were just talking about.
Yeah.
Yeah, but we have to build it in.
Yeah, we'd probably start out with a centralized one, I would think, of some sort.
I didn't realize you could. Okay.
Is that a major programming endeavor? I know you can't give estimates at this time. Is that a big deal to build that front end linkage into the system?
You know, I'm not sure as far as cost. I do know that we've done it now with at least 3 states, 3 different states. And so I know that I'm not sure, you know, obviously, like I was saying about the cost, but the functionality, the building it, the working with the IT, that seems to be something that we've been doing quite a bit with. But I definitely want you to talk with our programmer a bit more about that. Yeah.
Which states are you have you done that with?
Colorado, New Mexico, and Maryland.
Okay. Okay. Thank you.
Yeah, absolutely.
Good. Thank you. That was helpful. Good.
Say it again. Sorry.
Oh, that was helpful. Go ahead. Continue on.
Oh,
we can move ahead.
And so, as we are enrolling, if the person has not, you know, self-enrolled, say that we just received an email where we're getting referrals from providers, from health systems, our referring entities, those are going to be our overall overarching entities. So this might be Joni's health practice, or this could again be Kaiser East. So this is going to be our overall entity. I'm very sorry about the slow internet here. There we go. So of course, the same way that we were talking, you just tell it what you want it to do and add the entity. This can be any entity. Referring individuals, these are going to be the individuals that are referring from that practice. So if we are talking about Kaiser East Health System, excuse me, I'm going to sneeze.
Bless you. She's sneezing?
Yeah.
Sneezing.
Or is it?
Okay.
Well, there you go. Okay. So under our referring individuals, of course, these are going to be the specific people who are referring from a practice, from a health system, so that we can track it down to which provider. Again, this might be, though, this could be a health fair that we're receiving these referrals from Chapter 9 Health Fair. A referral.
And Joni, would each of those referring people or entities then have a log on? They would log into the system and then have access to whatever you've given them access to, and then they would produce the referral? Is that how that works?
If that's the way you would like to do it, you absolutely can. The way that we do it is that we have information come to us, the program coordinators, and then we follow up with the referral and enter them into the system. So we take a little bit off the referring entity's plate, and just kind of, we seem to see a little bit more success that way. If we're basically saying, you know, just fax us, we'll take care of the rest. But if you do want them to have that ability to just go in and enroll them into the class, then yes, basically all they would see is the functionality right here with their password and login information.
So what you're saying, Joni, is the way you do it now is if a person, a doctor, a physician, or somebody is referring, they would just call you or send you an email, and then that person who got the call or the email would enter the referral into the system. Is that what I understand you saying?
That's correct. That's how we've been doing it at COA. So we receive it, we enter it into the system, which is going to be this area that we're currently in here. We would enter in all this information, and then we get the person a call, and we track the calls that we're making under contact. And then if we do enroll them into a class, then all we do is pull down the class that we're going to enroll them in and put them in that class. So, but again, if you decide, if you are working with entities that you would like them to enroll into their own classes, you can give them access to just this area right here.
In your experience or your experience to date, you feel you have a better uptake with referrers if they call or send you an email and you enter it rather than them doing it because of what or why, or what's your experience with that?
Absolutely. When we have been working with different providers, and we go in and talk, a lot of times we've heard them say, get down to the click. That adds 3 more clicks to my session. And so basically this breaks it down into all we need you to do is 10, not even 10 seconds of messaging. I know you're working on this. I'd like to refer you to a class. Joni will call you. They shoot me the facts, and then I follow up. And so it just makes it really simple on their end. And we find that with the limited time they have with the patient as is, that's a really good way for them to actually feel like it's a service they can offer and have time to actually offer.
Okay, thank you.
Yeah, absolutely. And we actually have a lot of background information on that. So if we want to talk even more about some of the best practices we've learned as far as referral systems with providers, we'd definitely be more than happy to talk with you about that. Lindsay is definitely an expert in that area of getting us referrals and talking with health systems.
Great.
Okay. So again, all your information you would want to enter in for your referral. Again, our referring individual, which is linking to the functionality here. But then when we go to search, we are able to search people via all these different routes here, whether or not they're enrolled. We can check all the way down to the entity and the individual. So I can find which provider from Kaiser has sent me the most referrals, or I can say, hey, Dr. A, I don't have any, but Dr. A is sending at least 10 a month. So that's just kind of another way.
I think we're good.
Wonderful, wonderful. So under our participant report tab, this is going to be where we are entering in our participant data information. So if we're collecting any type of data, this is where that information is going to be entered in. And our report tab is where we're able to run reports based on the data that we've collected. So I'm going to just do a quick search. And as you can see, the information that is in here is de-identified. So this is all information that has already been entered in for past classes. And the information is all de-identified. If I go into my general area and I want to just add participant data, then we are able to go in and you're able to add that participant data for all the information. Tabs and information that you're collecting data on. So if you're doing a hypertension study and need 3 additional areas of information, you can add that if you decide you want that programming. You wouldn't have to keep coming back to us and saying, okay, well, now we're going to do a diabetes study and they need to know height and BMI. So this here is pre-populated. However, again, you do have the ability to add different fields based on the data that you would like to collect. Again, once it gets entered in, it does get de-identified.
So you de-identify, can I ask you a question, Joni, and maybe you're going to get into this, but do the provider able to see the pre and post test information and see how people are improving as you're de-identifying things? I mean, do you ever go back to the providers with those results, or how are you're de-identifying so you can aggregate the data?
So yeah, de-identifying so we can aggregate the data. We will share with providers information from their referral logs. So Tim Smith was referred, we enrolled him in a class, he completed. We'll share that type of information depending on what the provider needs. A lot of the times we provide them with aggregate overall data, not specific to each of the person, just as we start getting into a lot of HIPAA issues at that point. And because this here we start really getting into patient health information.
Yep.
So here because of the level of health information that we're starting to get into when we're collecting data information. Now, there are ways to collect pre and post information for specific patients, and we want to talk a little bit more about that, you know, as we move on. But the current general functionality of it, allows you to basically put in information for a class and to be able to run reports based on that information you put in there. However, it will not show the participant's name or first or last.
Okay, thank you.
Yeah, absolutely.
I'm going to just want you continue on to the reports because we'll have some questions about the reports.
And that's going to either so we can have a single or a comparative report. Of course, you put your information in here, the titles of your report. We're going to go with the one column at this point. You could run it by license holder, by any of the different organizations, different curriculums. I'm going to run one. Let's just run it on Santa Fe here. In my mind. Say next. These are going to be run it just on this one site. Next. There we go. And the reports do run as Word documents. And so this will just, again, allows you another level of being able to edit and add footnotes, graphs, anything you would like. So all the information that I entered in under the People tab, under the Participant tab, for this specific workshop site now shows up in a report style. And again, you can add, take away, delete any of this information as you would like. And this is a one-column report here. I'm going to create another one. We're going to look at a two-column. And this time, let's look at two different curriculums, see if we have anything entered in here.
Okay. So, Joni?
Yes.
While that's happening, so I'm interested in why these come out in Word rather than Excel, since they're data and columns, etc.
Just so that you're able, just a little bit different level of having editing ability. If they need to come out in a CSV, that's also an option that we can do. But we were just having that so that we can add it more in like a report form that you would share quickly with a funder.
Sure, so it makes it easy for us to do that. And if you wanted to set up so you could do an Excel or CSV file, CVS, whatever it is, then you could do that and work with the data or something if you needed to.
That's absolutely correct.
Joni, I have a question. So could you toggle between those two modes, the Word doc or the CSV file, kind of ad lib? Or is it something that you would set up on the back end and then it's always one way?
We would set it up on the back end, and from a programming standpoint, I don't think I know the answer. That would be a good question for me to ask our IT, just because I feel like that should not be, because I know we can run in PDF and CSV and toggle between the two. So let me check into that question, okay?
Thank you.
Can I ask you a couple of questions about reports now?
Of course.
Okay, so actually going back to how this information gets in there. So you could have one person entering all the data. Could you have each organization entering the data, survey data? depending upon how you set it up? I mean, does it have to be one way or the other, or can it be, multiple people, multiple organizations entering data?
Multiple people, multiple organizations enter the data.
Okay, good. Can you, if you wanted to set up a field, because say we want to report on several different levels, like you have, by implementing site, for example, and then next level up is by local host organization, the implementing organization. Another level, which I'm sure you can do, another level up from that could be our AAAs. So, we've got aggregated data at the AAA level and then at the state level as perhaps the highest level. Can you set up all of those different levels of reporting, and if so, how would you set up that AAA level?
Yes, for the, I'm trying to think. I might need Harry, our IT person, to talk through. Would you be willing maybe to send me that just in an email so I can visually just kind of see the words?
Sure.
If that's okay?
Sure, we can do that. It aggregates, by county, several counties together or something like that. Is that something that would need to be programmed in, or is that something that we would set up, just within the system as it is?
Oh, yeah, no. It should be able to be set up in the system as it is.
Okay, thank you. And then, can you export? I'm sure you're familiar with the NCOA databases for the Stanford Suite and the NCOA databases for the database for the Falls, the new, Shift the Balance to Falls piece. You familiar with those two, I'm sure?
Yeah, absolutely. And yes,
and anticipating my question.
Yeah.
Right.
And we've worked with several organizations now and have imported their old, their past information, and now have them set up to be able to import, export any of their new information. And we also have been working with the CDC for NDPP, the National Diabetes Prevention and Recognition, where once that data is entered in there, also it gets sent to the CDC for recognition. So again, only one place of data entry.
So if I understand you correctly, we can enter the data once into our system, and then there is some mechanism by which we send that to the NCOA database, either on the CDSME side or the Falls side, that automatically populates those databases, so they don't have to do anything on their end other than receive the file?
That's correct. That's correct. So
that's in place now and working?
That's correct.
Oh, great.
And I understood, this is Dawn, I understood the same for the NDPP and CDC, the same. And then, Joni, could you say who are your key contacts at CDC and NCOA?
Oh, goodness. So that's going to be definitely a scary question because he's our programmer there. I can get those quickly, but off the top of my head, they're not. I don't have them because he's working with them.
That would be great.
Yeah.
Okay, appreciate that. Thank you.
Okay, those are my questions so far. Thank you. Those are good answers.
I'm making myself a little note here real quick. Okay. So as we move down, again, when we were talking about the import-export, that's going to be this area here. We're in a demo, so this is currently not linked. A log, this is just going to help us figure out who is logged in last, what was last they did. So if we have, someone that's saying they don't know how to use the system and you go in and see they haven't been in the system for 3 months, maybe give you a good idea. Or this might just be able to help us figure out where maybe some data has gotten skewed and we can go back in and find out where that may have happened. And then, of course, help is getting you directly to us. And also, of course, talking with me and Harry, who's our IT. And again, it's going to go back up to these My Workshops. And this is going to be where you manage all that CDC information so that we're able keep the weight and activity each week, sessions attended, so that they will populate into that CSV file that's needed for recognition at the end. And of course, you know, everything that is encrypted. It is all backed up on an alternate server. So if there was some type of catastrophic event and our initial server was taken down, everything is backed up and encrypted also on that server. We do have access, and this, of course, is up to the organization. Most organizations leave it so that myself, Lindsay, or Harry can have access to your information, so that if there's something that we're having trouble getting put in, or you need to find, that we're able to actually look at the exact same thing that we're looking at and walk you through any of that information. It is, again, a software as a service, meaning that it is housed on a cloud, so that as long as you have internet, you can get to the system. It's not the same as a database that you have to have logged into, uploaded onto a specific updates that are being made. Get pushed across the entire system. So again, you won't have to do any type of downloading or giving a permission. That the system is actually going to do that for you. Okay, so I hope that wasn't too high overview, but definitely want to open it up for any more additional questions.
You know, I'm looking at your pricing, and so it's $7,000 for online access, and then annual renewal of $900 a year.
That's correct.
Okay, and then they do have, just so everybody knows here too, is that individual pricing, the importing of existing data. So if we wanted to get ours up to speed, 100. So it's interesting to see the pricing. How many clients do you have overall?
We are currently at 7 or 8 if my hotel brain is working correctly. So, and with that, 2 of them are large university systems, and 3 of them are large state systems.
Or state systems?
Yeah.
Is there anybody else who's, I don't know how much you know about what we're trying to accomplish here, but we're trying to set up a statewide network. We're basically hosting it here as MetroAAA, but we have the other, in partnership with the other AAAs throughout the state, to try to set up a very easy way for people to register, find and register for classes throughout the state, and then to track certainly the data, be able to send the data off to NCOA and as needed, also be able to report back to the various levels of our organizations involved. So are any of your clients right now doing something similar to that you know of?
Yes, absolutely. We have 2 state systems that we're working with that we're doing exactly that. In New Mexico, we're actually working with all the different curriculums and all the state organizations that all from, you know, in the entire New Mexico, so that each one of them has different levels of access, and they're working together with one centralized administrator. So yes, we do have systems that we're working with on that. If you want more detail about that, then I probably would like you to talk a little more with Lindsay, just because that's where her area of expertise is kind of overseeing those systems from the COA standpoint.
What is, Joni, a couple questions. What's the second system? So it's New Mexico, and then the other state, Maryland. Is that Colorado? With Maryland? Okay.
Did you say Maryland or Colorado? Maryland? Okay.
Maryland, and then?
Yeah. We have a collaborative system with Colorado, and so how that is working is that, of course, with COA, we work with, you know, hundreds of organizations. And then we have several different organizations that hold their own licenses that want to keep their information and will send us data for entry. Or we have organizations that really are kind of just lone wolves. They're doing their own thing. However, we do allow a collaborative system so that if there were other systems that wanted to work off of our state class site, they would be able to.
Just want to make sure. So was Maryland or Colorado?
Would we need then to go through Lindsay to kind of set that up, or to make sure it's okay, or do we just go ahead and talk about it? Yeah.
Yeah, the best way to approach it is through Lindsay.
Okay.
So I will follow up on that, but we'll need a couple of references to talk to about obviously usability and features and all of those types of things.
I'm going to ask you a question that you may or may not be able to answer, or may not want to answer, but how do you, yeah, obviously you're familiar that there are other products out in the market right now that try to do similar kinds of things. How do you compare or contrast yourself with the QTAC Compass program out of New York? Just anybody else, but any kind of perspective you have on that in terms of what you have to offer versus what they have to offer?
You know, as far as I have not myself gone deep into what I do know is that this system has been evolved over the past 7-8 years of us, our needs for implementing these community-based classes, these evidence-based classes. And so this has all evolved from a practitioner on the ground, working with different organizations. So the people who have made it are the people who have been using it for years. And every time that we see that there's a best practice that needs to be added, that's what kind of gives us, a little bit more leverage that we can add it in. I would have to to be able to speak to it in a real educated way. I would like to spend a little bit more time with both systems and pull up a compare and contrast. So at this point, I don't feel totally comfortable, saying do this better or that, other than I know that, again, this has evolved specifically from our needs of actually putting these classes out there. And we have also, established pricing and training really from the standpoint of a community-based organization. So organizations that maybe are working with limited funding and need a little bit more training and interaction along the way. So,
thank you. I think that's helpful.
That was
I have a question.
Yeah, no, I understand. Like I said, it's sort of a tricky question, but I always like to hear what people have to say if they have any particular perspective. So that's helpful. Thank you.
I have two more questions regarding, one is regarding billing. We just does the system do any kind of billing? So for instance, our CBOs are going to be providing the classes, and through the grant, they're going to get some money back per completer, or they'll bill us per completer. Do you have that capacity? And I just want to say, and then the second one is the healthcare payers. So our ultimate goal is to get MCOs, managing care organizations, to pay for the classes. And is there a way to track that? Do you have people talk to you about either of those features? Do you have any of those?
I'm not sure. As far as we can track number of completers, that is now, as far as the payers, I don't believe we've had any of that set up, but I can definitely check back with Lindsay to see where we might be in that.
Yeah, I think that would be helpful. Dawn, do you want to talk about that a little bit? We're probably a year or two out from that, we hope.
Yeah, we are. I don't know if there would be more to say right now, but I have a couple of other questions.
Okay,
so,
sure.
Just let Bob follow up on that particular question.
Sure.
So then I'm assuming that if you wanted to set up your registration fields, you wanted to add a field for healthcare provider, say it was relevant, this provider, that provider, you put that right in the registration. Then when you do your report on completers, you could know how many completers.
A way to approach it. And again, I would want, once you get Harry, looking at the hierarchy of how the information you would like to receive and how and what form you would like to receive it.
Right. Yeah, understood. Yeah.
So, Joni, you might have covered this already, but what platform is this database written in?
No, that's a good. I don't answer. But I can get that to you very quickly.
Okay, look and feel a little bit
like Salesforce.
Yeah, Salesforce.
Yeah, is it an Access? Is it a SQL database? Is it perhaps based on Salesforce? It would be great to know what the platform is, or perhaps something that was just created from the ground up. So it would be helpful to know that. And then, did you touch at all on the HIPAA compliance pieces, the security certificates, any of that kind of thing?
Absolutely. So hopefully you can still see my screen. Just pull up security of protected health information. Are you seeing my screen?
Yeah, yes, thank you. Okay.
I can send this information to you. I'm trying to give you an overview of how everything is secured for the client.
All right, that's great, thank you, and I apologize for the repetition. And then,
that actually.
And then, as we're looking at your product here, I mean, it's just very clean and very clear, and seems really user friendly. So appreciate that. And we're just, we're in the process of defining our needs and trying to understand what we might be able to do to put a system together or to build a system. So it sounds like there's a fair amount of customization that can be done. But what do you have any sense for the appetite for, I mean, pretty significant customizations and yeah, I mean, I think we're going to, we've got a number of partners that, and one in particular that's gone down the road a ways with, I think, a really interesting consumer community engagement approach with their web portal and the database that they're building behind it, but they don't have any of the nuts and bolts reporting database. And so as we think about who's got some, who's really been approach that will that we think might work for us, it seems that one way we might approach this will be to take pieces of products that are already developed, but of course that depends on whether or not the owners of those products might be willing to enter into a partnership with us to build something, to help us build something. So is that something you can speak to? Are you interested at all? Is that totally off the table?
I don't think it's totally off the table, but again, I want to defer to Lindsay on that to see what her thoughts are. But I will shoot her actually an email once we get off the phone with some of these questions.
Okay, super.
That's great. Yeah, just to say, just an example was with QTAC. I mean, they said it's going to say QTAC New York, as you get into the site. I mean, can we customize where it looks like it's from Minnesota? Yeah, we should be able to, right? All the way through.
Okay.
Is going in. What's the direct on the web address? So with the Compass project out of QTAC, I mean, you're logging into their product and their URL that indicates you're on a SUNY website, because you are, and there isn't another way to do that. Can you show us what this looks like?
Absolutely. So I'm going to just pull up New Mexico's. And so I'm not sure if you noticed when I put in, it's going to pull up their actual site. So it's NewMexicoWorkshopWizard.org.
Yeah, she said we could get a demo site that we could play on, which is kind of would be interesting.
Absolutely. So are you seeing my screen yet?
You're seeing your login.
We just see Workshop Wizard, the blue icon right now with your login.
Do you Mexico at the top, the NN?
No. Well, we do see that at the top, but that's not what we aren't seeing their website. It hasn't opened yet. We're still in Workshop.
Oh, so you were looking for. So you're not looking for necessarily.
There we go. Oh, okay. No, I think that's what we're, right? Or is that, you want to see further, Don, or?
This is the demo. Yeah.
So we probably can just go to, well, so would the New Mexico portal have a public portal page?
They do. They have a public portal page that is similar to ours.
Okay.
Hopefully you can see that. So this is going to be the what the user would see, what the public would see.
Okay.
And this could be customized to whatever degree we want with the various, obviously the various selections and pictures and all that sort of stuff.
Absolutely.
And then as you register for a class as a participant, or if I'm going as an administrator, then at the next level, is it still branded with my stuff, or is it the next level now back into Workshop Wizard?
Trying to think on here. If a person is going in and wanting to, that was, I'm going to have to ask that question to Gary, actually, our IT.
So I did, Joni, I did see back when you were showing the report, I think it was the report, there was a circle at the top of the page that said your logo here. And that led me to believe the customization works throughout all of the different tabs and functions.
That's correct.
Yeah, so, yeah.
Yeah. I think that answers our question. Yeah. It's a difference between, as you go into the system, it consistently feels like our system, even though it's your system that we're using, versus once you're in the system, it looks like your system, I mean, with all the branding and the different logos. Certainly, you've got to maintain the system as the system. But as far as verbiage or logos and that sort of thing, that can carry throughout as needed. Is that my understanding correctly?
Yes, that's my understanding also, yes.
All right.
So we have about 5 minutes. Anybody have any questions? I know we give you a long list to follow up on. This is Nora, so if you want to send that to me and I can send it out to our team, and if you need any clarifications, if you want to either email me or call me, we'll work through that. But it's I don't know about everybody else, but it was very impressive, and thank you for your time today.
Yeah, absolutely. Thank you all for your time. I will be on the road today, so I'll try to get some of this off before I get on the road, but it might be tomorrow if that's okay.
Oh, yeah. Oh, absolutely. And we know there was quite a few things there, so.
Joni, I just registration piece link up with the Workshop Wizard, or did you actually help them create their whole web page, including the registration interface?
We help your web page.
Okay. Great. That's helpful to know.
Oh, I do have one more question. When you initially start with an organization and you sign an agreement, in your experience so far, roughly how long does it take to get something up and running? What's sort of a rule of thumb there?
You know, it definitely differs because we're the different systems that we're working with, but it could be anywhere from a few weeks that you have a system up and going that you're
on something like that. Assuming you're going to be doing some sort of level of customization, that would be a reasonable time frame to be.
That's correct.
About.
Yeah, but we can definitely get stuff up and going, you know, prior to everything, all the customization being finished. So we can get some of the functionality as it's coming available.
Great.
Yes, thank you. And I think the fact that you sent your software service agreement and the other information, again, that helps almost jumpstart us, and you're really clear on the prices and all of that. So that's been helpful.
I'm sorry, I do have one last question. Maybe it can be handled in a follow-up too. I know we're running out of time. But in terms of infrastructure on our end to support this, what do you usually see? Is it take a manager level person that sort of owns it and then several staff people? And I know it depends on how you organize things in terms of people phoning into you versus to do things. But in terms of running the system, what rule of thumb do you usually think of in terms of what it takes to do something like that?
You know, we usually like to have someone that's considered an administrator at the organization that can give access to the different levels of people using the system. And it really does depend. You know, here at COA, we have 3 people with equal access that enter all the information, the data, we run reports, in addition to all of our other job duties. And so it really, you know, does depend on how it's set up and the level of functionality I think each of the organizations need. So if, you know, there's one organization that is going to be doing everything from referrals to printing reports, you know, they might need someone who's designated for that. But again, that might be something we want to talk through just a little bit, your roles and the curriculums you're.
Okay. Thank you. All right, I think that covers it. Thanks again for your time. Safe travels, all right?
All right.
Thank you.
Bye.